and welcome back to the Tech Pro Unicorn podcast. I am your host, Michael Grace, and today I am joined by another healthcare colleague. I'm joined by Michael Boerner, and he is the founder and CEO of Engage Technologies Group Incorporated. That doesn't really tell you anything about what the product is that we're going to be talking about. So we're going to spend most of the podcast really talking about this company that Michael's founded and how it's changing healthcare. So if you're interested in healthcare and healthcare technology, this is going to be a really great episode for you. So Michael has over 25 years of experience founding and leading technology and media companies. He's an entrepreneur responsible for innovating a number of short-form video-based enterprise technologies, enabling data-driven video personalization and mass constituent engagement. Michael's clients have included Johnson & Johnson, CVS, Ford, Samsung, UnitedHealthcare, Covidien, UPMC, St. Luke's Health System, K through 12, Blue Cross, Blue Shield, Minnesota, and the Ken Blanchard companies, just to name a few. So, Michael, thank you for taking the time and joining the podcast.
Michael, thank you. Appreciate it. Also appreciate all of your thought leadership in healthcare over many years.
Awesome. Thank you. So we talked a little bit about Engage Technologies in the intro, which really doesn't say much about what it is that you guys actually do. So maybe tell a little bit about your journey. How did you come to see a problem that needed to be solved, and thus the creation of Engage Technologies Group, and what does it really do?
Yeah, absolutely. So Engage is really all about the concept of transforming lives by delivering timely wisdom. And in my early 20s, I was just really impacted by the concept that new amounts of knowledge and wisdom could really transform someone's journey, whether it's their professional career or their marriage, their relationship, their leadership capacity. And so this whole idea of, wow, if you could put knowledge in people's hands right when it mattered, height of interest, time of need, it can really have a true transformative impact on people. And so I ended up being involved in high-end content production for many years, got to work with great people like Ken Blanchard and Gary Smalley and Kevin Lehman, people who had sold millions of books and who had a tremendous amount of knowledge and wisdom. And so we came up with an idea back in 2005, 2006 to put their wisdom on the internet. And people kind of forget, there was no video website before 2005. There was no YouTube. It was all dial-up. And so 2005 comes along, 2006, and there's this wicked fast 256K that shows up. Have you guys seen this? This is so quick. And so we realized, hey, you could actually stream video content on the internet with this kind of speed. And so we had this idea of going out and shooting some of the top experts on all these different environments and different categories of life. And because we had relationships and I was on certain board of directors, there was access. And so we said, hey, what if we created the first website, it was called iQuestions at the time, that featured all safe and trusted wisdom from the leading minds, where it would be 2 to 3 minute video clips that had them answering the top questions people would have, and you could summon it with a mouse. Seems simple now, but back then there was no such thing. And so we actually built one of the first video websites, all content originally shot, dolly track lights. We shot it in broadcast high def with $75,000 Varicams on, track, et cetera, like making a movie. And people ask me, why in the world are you shooting broadcast high definition for the internet? And we also shot it in widescreen back when all the TVs were still 4x3. But we knew if you shot it properly, it would have a great future proof because so much of it was evergreen content. So anyway, long story short, we shot all this content, put it out there, and it ended up being an incredibly valuable new method of transferring knowledge very, very quickly. But someone from healthcare came along and said, this is brilliant. What you've done is created a consistency of messaging across a continuum of care. And so we started developing software to intelligently organize these video storytelling assets to put it in now what we call an arc of engagement. Then we'd wrap it in the brand of the customer. And so that's how we got into healthcare. And it's just kind of been a rocket ride ever since.
I love it. It's funny. 2005. I date myself when I jokingly say, right, I was around when AOL was first created. I had the opportunity to be employee number 8 at Yahoo, and I was like, who the heck who the heck would want to search the internet? What is this internet? This is some educational thing. Like nobody wants to do some searches. There's nothing out there. Who cares? So I didn't opt into that, right? And the progress just, I think when we look at today and everything is phone based and app based and picture based and movie based, nobody wants to even communicate via words anymore. Everybody wants to tell their life story through a picture or through a movie. That's how we communicate and how we more easily digest. It's hard to remember that this rise has been so fast from
and
a
so
technology perspective. Yeah, especially in healthcare, right, where we're probably still 5 to 7, maybe 10 years behind other industries in the adoption of technology. So you guys picked kind of a laggard industry, if you will, right,
yes.
to try to help change and revolutionize and modernize.
Yeah.
The way that you guys deliver the content, and just to share with the group, Michael shared a little bit about the platform and let me kind of play with it a little bit before we jumped on here. It was super easy, right? I mean, we didn't prep for this podcast any more than just a minute or two before we jumped on a Zoom call, and I got to experience the tech. And it was a couple things that stood out to me was it was very consumable. It was on existing devices that I already had. I just picked up my phone, I scanned a UPC code. Maybe walk folks through, like, what's that experience like? I mean, you guys are providing incredible amounts of knowledge to folks in a really consumable fashion.
Right. Well, you hit the key word. When it comes to a consumer experience where you become a patient, when you're healthy, you don't really pay attention to the healthcare industry until suddenly you need it. And when it comes to healthcare, it's among the most crisis level things we will ever experience. And so there's a lot of anxiety, and anxiety is not very effective for learning. And so, especially in a COVID world, many times you couldn't bring your family members to these appointments, et cetera. And so the core of our company is really all about transferring knowledge very, very rapidly, but also very frictionlessly. Because the real problem with so many of the great things that are out there is there's too much of an obstacle to get into the portal or download the app or go through the email and password kind of pairing. And so our technology, we finally have the simplicity we've always wanted to be able to use the three biggest mass consumer behavioral shifts that are out there. Mobile first, this huge desire for video consumption. People now prefer video for learning over virtually any other tool. And if you look at any of the ComScore numbers, the video consumption rates are always a hockey stick every year. And then third, we've built in this very interesting channel preference people have today, which if you ask just about anyone in the world, what's the primary way you would prefer to communicate? Almost everyone will say text. We all love text. And what's interesting about text is it's not email. It doesn't have the chaos or the spam. It's not social media that's a never-ending river. It is this private little eddy that we almost all keep at inbox 0. And it always has the promise of brevity. And so it's this fascinating little place that we have. And so we brought all three of those things together, mobile, video, and text, and have a proprietary tech stack underneath it that finally solved the mystery of how you get rid of the barriers. And so we don't need any apps or emails, et cetera. So let's say someone is told by their doctor, they go to see their optometrist or their ophthalmologist, hey, I'm sorry to tell you, Michael, you have cataracts. Wow, what's that? Is that cancer? No. It's a natural thing that happens in your eye with the cloudy lens, kind of like the back window of a convertible, finally gets thick and you can't see through it very well. It's the number one surgery in the world. And wow, I need to have surgery on my eyeballs. That's a pretty crisis moment for people to go, ooh, that's scary. Well, now you need to go through a cataract evaluation and be prepared for that surgery. Well, now all they have to do is be sent via a text, or if they're in front of the doctor, we have these little touch cards. And so we actually have a QR code and a keyword here. But before people think, oh, QR codes, well, we don't use a QR code the way everyone else does. A QR code's been wonderful because it's now being read by the iOS, right, on the phone or the OS. And so what we do is we use text. So all the person has to do is type in a keyword to a short code, but we actually use a QR code that allows it to be focused on by the camera, and it types out the text for you. That's the only thing we use a QR code for. When they tap send, it goes into our proprietary technology and sends them back a link from their doctor in their brand. So that's why it's coming from their provider. And now all of a sudden, when they tap the link, it puts them on this yellow brick road we call an arc of engagement, broken into snippet-based content, about 90 seconds. And you watch the first episode, and it tells you, welcome from our practice. Here's what you need to know. Second one is, here's what a cataract is. Third one goes on to all the different options. So it just takes them on this beautiful guided journey by a trusted relationship wrapped in the brand of their practice, their doctor. So we build this beautiful universal content with some of the top key opinion leaders and medical advisory board members. We brood over that whole process, build it, have it approved, and then we deploy it. And it's kind of like Netflix for business. They pay a monthly subscription and they get all this technology, all the content wrapped in their brand, and now they can use it. They can send it to their patients beforehand, summon it there chairside, and they can also use it for pre and post-op instructions because now it drips to them just in time. So it's this beautiful new way to kind of hold the patient's hand end to end throughout the comprehensive patient experience.
I love it, right? It's a technology that to me kind of has a win-win. The providers spend less time doing education, thus increase the amount of time that they have available to see more patients, right? So there's an economic upside there. From the patient experience, the first question I asked was, hey, once I go down this yellow brick road, can I go back and watch a video too? Because I didn't quite get that. Or can I share it with my wife because she wants to understand and she has questions, and the answers to all that are yes. I have my mom's 85, so I get to watch her go through our healthcare system, and man, if that doesn't fire me up every day to come in and try to change healthcare in some way, I watch her go through procedures, and she's in like this period of recovery. She just came out of a procedure. She's still groggy from anesthesia, and they're handing her like post-care paperwork and talking to her. And I'm like, you understand she's never going to remember this stuff, right? You understand that this is totally ineffective. But, hey, nurses, like, no offense to nurses, my wife is a nurse, so, but, hey, it's 4:45 and surgery center closes at 5, got to roll grandma out the door and be gone. And she gets home with her care providers and they're like, what are we supposed to do?
Right.
Like what happens? And you don't want to call the after hours care because you didn't understand that flurry of information that was handed to you with the intent to just get you out of there.
Yes.
This gives you access. I've always said like people should record content, but then it comes to how do you secure it? How do you, we get into that whole HIPAA compliance and because we're always trying to attach education to medical records, right? Mm-hmm. And when you do that, you create a HIPAA firestorm that stalls out innovation in healthcare. And when you think about this technology, you're providing education not attached to a patient record. You're attaching it to a procedure that's generic but specific enough to their actual procedure that it has great value without all the baggage that comes from the HIPAA constraint.
Yeah, that's absolutely right. And you're absolutely correct when it comes to the amount of learning. First of all, they're not in a great state to be learning. Hallway amnesia is a very real thing. And in fact, we just finished our new knee, hip, and spine. In fact, I don't know if you can see this, but this is kind of a picture of the pre and post-op instructions. And so This is the full arc that walks you through. Well, we had one of our team members go through and write down in the pre-op, the pre-appointment, the pre-op, the post-op, everything they're supposed to learn or understand or know about. It's 137 items. So the amount of things a patient needs to really know through that entire continuum is so substantial. And how often do you think the practice gets it right? It's so difficult with turnover and consistency of messaging. And so now there's a way to not only get it right every time, but it's always done in a very positive, happy, sincere, and empathetic way, which is the way we design our content. And so now you have a method also to share with the caregiver. So in our workflow, there's a button where they can actually push to send to the person who's going to be taking care of them, picking them up, taking them home. And so the caregiver the first video they receive is, thank you so much. You're one of the unsung heroes of healthcare. Thank you for taking care of your loved one. Here's what you need to know. So it's kind of a whole new way to think about the comprehensive care from a practice. Because to your point also, it's a huge lift on the practice to get all that right every day. And so the operational efficiencies that are driven when the patient already knows all of this, it saves so much time. And you know what we kind of weren't really expecting is how much this affected the provider experience. Because among the least favorite things a provider does is repeat the same things over and over 50 times a day to patients all day long.
I was sharing with Michael, my wife is a lung transplant coordinator, and you can imagine the amount of instructions, right, that have to go pre-transplant, post-transplant. And then I'm always like, how do you keep that patient engaged, right? Because that isn't something that's scheduled. It's not like, oh, April 15th, Michael, you're going to go have your knee replacement surgery. You have to wait until there's an appropriate donor, right? That matches all the complex criteria of transplant. So how do you keep that person ready, engaged? And to me, this kind of fits that need, right? You're giving them content to review, something to be engaged with. Oh, let me brush up on video too, and it's just because what happens, right? When I watch people in procedures and they get told they need a cataract surgery or whatever, what's the first thing they do? They go out to the internet.
That's right.
And they search cataract. And I'm sorry, medical community, but there is some crap content out there. There really is. There's a lot of misinformation. There's a lot of horrible videos out there. There's a lot of salesy, like, yeah, you could get a cataract surgery here, but Dr. So-and-so is amazing and you should come over here. And it's got a real sleazy content about trying to take patients. Whereas, from what I saw, you guys are just providing procedure-based education, to help the person prepare, experience, and recover.
Yes, that's right. And you're absolutely right. When it comes to searching the internet, there's a lot of great information, but the signal to noise ratio is so heavy, it's very hard. And in today's world, we like things to be curated for us. That's why we have things like Stitch Fix. Hey, somebody send me a really nicely organized thing that I'll really like so I don't have to sift through, thousands of environments. And so when it comes to the doctor giving you something at the height of your interest, at the time of your need, from a trusted relationship that actually applies to the way you prefer to learn in today's world, which is this powerful new thing that we have in every pocket and purse. And the other key thing about it is it allows us to also measure it. So we, like when you scanned into that earlier, when you tapped send, it went into our proprietary platform, and now we're using your cell number as the unique identifier instead of an email and a password. Well, now we also know what percentage of the video did you watch? What percent did you not watch? It will automatically send you an oops reminder if you didn't watch it. It knows what you clicked, it knows what you didn't click, and it's all coming from that trusted relationship of the practice. So now, like we've had over 60,000 patients go through the cataract video content, and we're seeing like an 87% completion ratio average of all of the content, and they're binge watching all of it, so over 70% of the patients, all on the first day. They're not waiting for it to come to them. Because if they watch, say, 4 in a row, then the next morning it texts them episode 5, and if they forget, it reminds them. But it's amazing how when you provide it at the moment that they care, when they're leaned in, they're most teachable, you make it no friction to access it. They are so excited. And our platform also has the ability to ask questions, to get sentiment feedback. And so that sentiment feedback that we receive is just off the charts because we've spent all this time listening to the patients, to the doctors, to the nurses. So when we design it, it's a little bit like Bill Murray in Groundhog's Day. He got so sick of that town, he wanted to kill himself. And one day he realized, you know what? I should use this, I would call data, to go and know exactly when Johnny falls out of the trees right there. He knows when to jack up the car, when to do the Heimlich, when to light the gal's cigarette. He becomes like the mayor of the town because he takes advantage of all this knowledge and he's right there when it matters. And that's what this is really designed to emulate.
Well, let's talk a little bit about the phone, right? You guys could have designed this to be a web link and consumable on computers. Excuse me. There's still a lot of folks that don't have computers, right? Like my mom has a laptop, and thankfully, no offense, mom, but thankfully she uses it to play solitaire and, check her email and respond to
Right.
Facebook. And that's about, the extent. Again, she's 85.
Mm.
I have a sister who's well into her 60s who also doesn't have a computer, right? She has a phone, she doesn't have a computer. So how did you guys choose the phone as a medium to really deploy this on?
Yeah, well, it started with the computer. So many years ago, we were working with Johnson & Johnson, DePuy, the hip replacement division, and Coach K was the spokesman for J&J DePuy at the time. And so we sent our crews out in our previous company and shot all the content. But back then, phones didn't play video. The iPhone didn't play video when it started either. And so back then, you needed to actually serve it up through email, watch it on a PC, and it was still a sequenced video experience. But then when you started seeing the infrastructure come about, where you had the ability to have phones that would play video, streaming was finally capable, and that all of a sudden changed the game. And then you also watched that point where phones took over from desktops in terms of maturation curve. And so now you have the absolute majority going to the mobile first. And so that's when we began to design a new technology methodology that would allow us to take advantage of this new structure we've never had before. What I find interesting about new infrastructure is it changes business models, creates disruption. And of course, there's the famous, Blockbuster to Netflix change. But what I find interesting about that is, every system is capable of a maximum efficiency until it's a different system. And so Blockbuster Video, I think, was probably right at the front edge of the most efficient system you could have with a physical item that they were renting. Mm-hmm. Then all of a sudden, infrastructure allows it to be streamable. Well, now you've moved at Blockbuster's height, their valuation cap was about $5.5 billion. Well, Netflix comes along and figures out a way to do something that's almost never happens, dramatically improved customer experience, dramatically decreased cost, which is a wonderful thing when that occurs. Well, they have a valuation, depending on the month, $200 billion. And they switched the business model from transactional to subscription. And it became much less expensive. There's no more sold out. We have 4 daughters that we raise, and sorry, girls, video is sold out. Sold out. That's not even a thing you say anymore, let alone 2 trips to the video store to rent and return it. So I'm fascinated by the idea that we can actually make things far better, far less expensive, and more importantly, far more efficient. And so the mobile phone is now, I think, we are too addicted to it. I think, frankly, we need less screen time. But when the screen time matters, you want the right information that's been curated, that's trusted, and brief. And so it's kind of like we grab the middle of the cinnamon roll and put those things together. So everything's very concentrated, no wasting of time, and extremely efficient on both sides.
Right. I love it. I mean, I love what you say about that, the screen time. If you have an iPhone, I'm sure there's an app that does it on the Android as well. It tells us what our screen time is. And now it tells us like what you did on your phone, like where did you spend your time? And every time I talk to folks that want to start a business or folks in business, and they're like, I just don't have time. I'm like, give me your phone. Let me look at your phone. And they're like, well, that's really personal. I'm like, then don't make an excuse that you don't have time. Because I guarantee you, if I look at it, you spent 10 hours a week on social media. You consumed a whole bunch of, questionable value content. You make choices, right? And that doesn't mean that people shouldn't relax and people should always be in some self-learning mode. I'm not suggesting that. But we can all find time for what we perceive as truly important. And to your prior point, people get anxious. Up until very recently, right? I'm 55, almost 56. I hadn't had any type of IV. Right? I've never had an IV. I never had anything in me. So they're like, oh, yeah, you're going to go get an MRI and they're going to put this fluid in you. They're going to use an IV. And I was like, what? Like, I was in I've been in fight or flight, right? And I'm like, wow, I've been in healthcare for over 30 years and I've never had an IV. I've seen IVs. Everyone around me has had IVs. But like, I had all kinds of questions, right? My doctor was looking at me like, are you nuts, dude? It's just an IV. Relax. You'll be fine. And I was like, but I have questions, right? And I want information. And so here I am tying him up as he babies me, through I have to get an IV process, which was crazy. My wife, who's younger than me, but still, right, to your dental videos, she's never had to have a filling ever. She's
Wow.
in her late 40s, never had a filling, and she's nervous about the dentist. So the dentist says, "Oh, you have something here we're going to fill," and she's like, "Oh my gosh, right? Like, what is a filling? I've never had one." Most people grew up as kids having fillings, and she wanted information. So she's out on the internet, like, what's the anesthesia? She's a nurse, right? So she's like, what anesthesia can I use? And I had all these questions, and there was no official content by that office, that informed her. So when you think about, right, those are just my personal stories that you guys could have filled a need for that obviously our providers aren't providing. Our doctor does have an app. He uses Heal Owl, which is a smaller EHR system. And, he'll post lab results in there, and I can log on through this very complex, ridiculous process. And I can go on there and I can be like, wow, I'm getting close to borderline high cholesterol. That's great. But I can't talk to him through it. I can't interact. I can't get more information. I can't get information about high cholesterol. I just go out to Google and go, oh, what do I do about this, right? And if you think about that, I always talk about changing the patient experience. What a different experience if he said, hey, Michael, here's your lab results, and here's a QR code for you to check out, and here's lots of information on how to reduce your cholesterol. Totally different patient experience.
That's right. Well, and that's what I think we are coming to expect. Frankly, when you show what I've showed you about how we do what we do, if they're on the older scheme of life, maybe 60 plus, they're like, wow, that is so cool. This is so impressive. You show someone in their 20s and 30s, and they're like, yeah, of course I should do that. And so we have an expectation of the younger generation where, why doesn't it already do that? I show up to a hotel, there's a line. Didn't you guys know I was coming? There's just a whole new level of the consumerization of healthcare. And I think with the IoT coming, biometric wearables, a huge amount of data, we need to use this data to serve the patient experience and make sure that we can really accomplish what needs to be done in a much shorter amount of time. We've got to lower the cost of healthcare. There's no way we can keep up with the way that it's trending. And so if we don't find more efficiencies, we're going to be in real trouble economically. But I think also we can get more efficient at every level by just having the right amount of wisdom applied where it matters at the right moment. Plus, it stresses people out, and there's a way to really relax the mind if they can really understand what's going on.
Awesome. Yeah, it's so true, right? Is there, you guys are developing content, and you've got some healthcare that you shared, and you've got some dental, but really, right, I mean, it's cool that you're starting in healthcare, but really this could be valuable for almost anything, right? I'm watching I have some kids that are, in their late 20s, mid to late 20s. I have some that are in the younger 20s. I have 5 kids, so I have all kinds of continuum of life experience that I get to watch. And I watch them buy a car, and they have no idea how to negotiate an auto deal, right? And I spend all this time and I educate them, like, these are the things you should look for. I watch them try to buy a house, and try to understand mortgage lending and the finance, and and I'm just like, I just think about this technology and my head's like exploding with like, what a cool way to just be like, hey, you want to learn about leasing a car? Here's a QR code, and then it'll walk you through everything you need to know about leasing so you can make an intelligent decision.
That's right.
I would love a dealership that did that. I would trust them, right? They're providing me information so I can be an educated consumer and participate in the process. Much like you guys are doing for healthcare, I can be an educated consumer of healthcare, patient, and I can participate and do what I need to do to make sure that there's a successful outcome to the procedure.
That's right. Well, our whole mission statement is really around knowledge empowers when it's delivered by a trusted relationship. And that empowerment is amazing if you can take that knowledge and make it really easy to consume and make it extremely easy to apply. But also, when it comes to the application, really what we do at the end of the day is transfer wisdom really efficiently and also in the brand of someone else. So we made the decision to be a serving brand. So everything is white label. So whoever we work with, we make it look like they invented it, which is fine with us. And so we're heavily in healthcare, but now we're also looking as we expand into financial services, into veterinary, into another big area, which is CE, continuing education. Imagine if you could have content dripped to you, but the platform knows if you watched it, and it also can ask you a question at the end of it, but again, with no login. And so what's different, you see a QR code connected to a lot of our technology, but all a QR code does at restaurants and everywhere else is drop you on a cul-de-sac with no data. Our world, we use a QR code to automate a text, and that text brings it into our proprietary platform, which has 4 quadrants of tech. If you geek out for a second, because you need SMS and MMS technology for texting, which also connects to landing pages where all the branding is held and the footers and the links. You also have to have a CRM that is monitoring and tracking everything. You also need rules engines and marketing automation. So those are 4 big quadrants that you would see on any good Gartner chart. Our technology was hand built specifically for mobile with all 4 quadrants in one stack. So our technology has all 4 of those, which is why that interoperable ability allows us to have the CRM connected to the cell phone, which is what we use for the unique identifier. That's how we can track everything. So we don't use a QR code to just go to a landing page. We use a QR code to start a text that goes into that process. So now that gives us all the data, all the analytics. So we actually have about 7 different quadrants. People ask about competitors. And there's 7 different types of space that we're in. But we're at this unique intersection between all 7 different parts of that space. And if you move our logo into any one of those 7, we have a lot of competitors. But in the middle, there's no one at the intersection of all of them. So that's what's interesting about what we do. And so we love the ability to serve industries and be in a position to use tech meets content meets industry knowledge. And where all 3 of those Venn diagrams kind of overlap, that's kind of our white hot value proposition to make it simple.
I love it. Yeah, because you could just be a content producer and produce all this content and then put it out there and be like, hey, for $20, you can come consume our content. And odds are, right, knowing the American consumer, they'd have the best intentions. They pay the $20. Yes, I want to do that. They'd watch 5 minutes of the first video, get totally distracted by life because somebody on Facebook just had a baby and off they spin. And then they'll never come back, right? And then they go to their procedures. They're totally unprepared. They didn't do their pre-work, right? They didn't fast. They didn't do all this stuff. They don't have somebody to take them home. They're relying on Lyft and Uber and all this other insanity of the healthcare space. And it leads to poor outcomes and poor experience, right? And then the consumer themselves, of which they are at fault for not doing their part in the journey, complains about healthcare. And really, they should be complaining that they didn't hold up their end of the bargain in a lot of cases. Not in all cases, right? There are some procedures and such that go wrong, but a lot of it is they didn't understand. I honestly believe consumers enter a healthcare procedure-based kind of transaction with the best intentions, right? They want to do the right thing. They want to have a successful outcome. But then, again, nurse comes in and goes, oh, okay, Michael saw you, and now here's all the things you need to do, and here's a piece of paper, and here's another paper, and here's another paper, and here's another paper, and you're like, wow, what do I, and you just leave there in this dizziness of what the hell just happened to me.
Yeah.
And I think I need to not drink water before I get a knee replacement. I don't know.
Right. And by the way, if I do eat before surgery, they're going to cancel that surgery. Or I forgot about that. And the cost of those rescheduling, et cetera. And the other thing about healthcare, and I don't think it's at all intentional, but people like yourself, your wife, who've been in it for a very long time, you get so used to it. And so when patients come in, they are truly, even yourself with an IV, ooh, this is a little bit scary. And so the level of compassion kind of sometimes accidentally gets a little bit stilted. And the instructions come out a little bit more monotone, which are hard to pay attention to what's important and what's not. So that's one of the things we love about putting this in the provider's hands, is because when you're shooting content, you can make it perfect. You don't stop until they get it just right with a certain amount of smile and sincerity and empathy, etc. And we do, tone-based mapping all the way across that patient journey. But another thing that's interesting is you go across the content, each episode has certain links below it that can actually connect that patient to something that's relevant about that topic. So it could be a PDF, it could be a link to a piece of research, it could be a link to a TED Talk or a longer YouTube piece of content. So as you go through that journey, some people want to go deeper. And so this enables them to go much deeper into that topic. And for those that don't need it, they can just kind of bypass it. But it's a really nice way to also put great collateral, including pre and post-op instructions, et cetera, all the way through. So you're adding value at every step along the way.
The other thing I really like is that checks and balances, right? I can't tell you the number of times people go, oh, did you do all this? Oh, yes, I did. No, you didn't. You're just, you got whatever, right? The technology has the ability to tell the consumer, no, you really didn't. Like, we can tell you didn't watch these 8 videos. You watched 2, you didn't watch the other ones. And then the provider can make a decision, in enough time to get a reschedule of that time slot and be like, you're non-compliant, so we're not doing the procedure. And we're going to reschedule someone else. And when you finish those, let us know and we'll reschedule you, right? Yeah. There's a practice management component that allows, again, a revenue upswing to that provider without them really having to do that manually.
Yes. Well, in the next big phase for our company, we intentionally designed the workflow to not need any IT integration whatsoever. So practice can subscribe, they can start utilizing, they don't have to have any IT connectivity, but they still get all the data because of the way our tech tracks it. However, the next big phase, as we have begun now to integrate into the practice management and EMR systems. So now the staff, they just simply do what they normally do. They schedule, they put people into their system, and then our technology directly integrates through an API relationship to that tech. And so now it pulls that data out and pushes the content and brand of that practice right to the patient, right when it matters. So there's no additional step on the staff at all. And so that's creating huge amounts of consistency. In fact, in the premium ocular world, it's kind of an odd surgery. It's a very cool surgery. It's one of the only ones I know in the world where you get the surgery and you go back to being 20 in 10 minutes per eye. And now you've got a new lens in. You can see 20/20 without glasses. It's pretty extraordinary. But in the cataract world, you actually have a choice. And so this is kind of unusual. Insurance pays for a basic cataract replacement, which is like a single focus lens. But if you want to write a check for $3,500 per eye for premium lenses, which are trifocal, so it has near, intermediate, and distance, but insurance doesn't cover the premium. And so if you want to write that check, well, only about 15% of the mass population in the US say yes to writing that check. And those that do are thrilled because suddenly, wow, I can see without glasses. I mean, imagine being 80 years old and being able to thread a needle because the vision is that good and no readers. Well, our technology is now allowing these individuals to be able to understand these options. Because how many times when you have surgery do they ask you, okay, would you like the hip replacement that lets you walk or run? It's a little bit more money if you want the run version. What? Is that how that works? But in the eye world, those are the options. And so once our platform was deployed in these practices, we're seeing 25 to as much as 261% increases in these patients saying, yes, I'm happy to make that payment because now I understand what it is, how it works, what the value proposition is. And so that consistent messaging is creating huge amounts of profitability. And even more importantly, the patients are so happy that they now understand. Because frankly, if people are living a whole nother generation now, they're living far into their 80s with these healthy lifestyles. And so suddenly, if I could pay $7,000 over the span of 20 years, that's an incredible bargain. But many people don't realize that because there wasn't time to explain it properly.
Yeah, if you think about that from a patient experience perspective, when the physician says, during the consult, of which they're generally 15 minutes, right? So he's going to spend 15 minutes. We're going to talk, oh, you have, cataracts, blah, blah, blah. And then, oh, do you want this or that? One does this, one does that. It's probably less than a 30-second education on the differentiation and then they're expected to decide right there, right? Because they
Yeah.
gotta
How many
they
of us
gotta
make
check
the
a
same
box.
$7,000 decision kind of in the moment?
Yeah,
Difficult.
yeah, and then it goes off. Versus, hey, we're gonna give you this education, and then let us know. Go home, make a decision. We'll get you scheduled. Uh, because the time frame for that procedure probably doesn't vary much whether they put lens A or lens B in.
Right.
So they're able to still schedule the patient, but then the patient has a totally different experience. Like, wow, I really understand both, and now I can make an informed decision whether it's to upscale or not, based on their own situation. But at least they feel informed. That's the if you just. I often tell people, right? Like, I get goosebumps when I think about improved patient experiences.
Yes.
Um, and if you think about what you guys are trying to do and doing, success, not trying, you guys are doing it. Um, it's just like it's a game changer, right?
Mm.
In a critical piece of healthcare, which is informing the consumer so that they can be better prepared, make better decisions, and recover, and have successful outcomes.
Yeah.
It's very
Well,
cool.
I think for the first time, also, we have the opportunity to get ahead of the market. When you think about the new ACO models and capitated care, and this change from fee for service to a model where you're trying to keep utilization down by keeping people healthier, it's kind of moving
Mm-hmm.
more towards the dental prevention model. And so being able to use technology and data and working with the health plans, because they know exactly who you are, they know what your age is. So all of a sudden, hey, happy birthday, you turned 50. That's exciting. Hey, one of the great things about turning 50 is we encourage you to go ahead and schedule a colonoscopy. Go ahead and tap this link below, and we'll actually connect you to your primary care provider who will make a recommendation, or a multiplicity of things that can be done to help make a more concierge type of an experience, but without the human lift. Because with
Mm-hmm.
the power of data and compassionate content that really honors people about where they are, not pushing people, but just simply gently helping them through that journey. And so it's a whole nother way to be able to keep those costs down and also make sure we have a lot more prevention happening because the data can make it scale.
If you think about all the garbage, right, that comes to our devices and our phones, right? You shop at a store, and now every day you're getting told what the Best Buy super sale is, which, honestly, I enjoy, because I'm like, oh, I don't need that, but that's a pretty good price on that. Right. But we get just inundated with all these salesy texts, and you're like, delete, delete, delete. What if we got a text that was, meaningful from our provider, right? I don't hear from my physician unless I call them and make an appointment and go in and have an experience, right? I wouldn't mind hearing from my provider. I wouldn't mind getting information, text, reminders about appointments, or information about, hey, you're 50 and you should do a Cologuard or something like that, right? Like, it would get me to think, interact about something that's useful and meaningful and changing, of people's lives. Um, Very, very cool stuff.
Mm. Well, that's
Um,
what's motivating our team, and the ability to help transform lives by delivering that timely wisdom is such an honor. And it's a joy to be able to work in the healthcare world. These people are heroes. We do a lot of shadowing, spending a lot of time with docs, and boy, our respect for what these people do day in, day out is amazing. I was just at a cadaver lab 2 weeks ago in Nashville watching orthopedic surgeons do knee and hip and spine. And my heavens, it is construction meets architecture and engineering. And the
mhm.
physical energy it takes to do what they do and the low reimbursement. It's just amazing what servants these wonderful people are. And so it's just a joy to be able to serve. And it's wonderful to be alive at that moment when technology is finally making things simple, faster, cheaper, and easier. And really, it's the power of storytelling. But having a technology SaaS based infrastructure to deliver that is really a joy. And so, boy, we just really enjoy what we do every day with our team.
It's awesome. Well, thanks for sharing how technology is making a difference, and sharing your app and your tool with me. For those of you that are like, this is cool, but I want to see it, I want to understand it a little more. Engage TG, the letters T and G.com. Link will be down below in all of it. But Engage TG is Engage Technologies Group. Incorporated site. On there, you can click on ocular and dental and health, and you can get an idea of how this is working. There's a little bit of the videos out there that explain this, that talk about the patient process, and give you some great screenshots of both the card that Michael was kind of holding up. If you're listening and didn't see, Michael was holding up a little patient card for the Bright Eyes, which is just a sampling vendor company. But you can see those cards on the website as well. You can get an idea of what that interaction is like. And it's a bit of a game changer if you think about the patient experience. So, Michael, thanks for what you guys are doing, enabling providers with a better tool to have better patient experiences and ultimately better outcomes. Appreciate it.
Michael, thank you. My pleasure. And thank you for all you do to help spread the word around new innovation.
Awesome.